Yes, it would take about 3 teams of 2 and a supervisor, or at least a lead of some sort, to hit all of those. With all, we have to inspect.
What do you mean hit, oh, like you would just
We
do
would
it
have to
and
do
then send
all,
them a bill
we
and
would
it goes
send
with our
people out,
taxes?
yep, so there'd be a
Okay.
non-compliance fee, there would be inspections, we have an audit that we'd have that would go on. It's an additional, roughly 6 people that we're assuming right now. Now, what I don't like about this is that, and why it's gonna impact the discussion here,
Yeah.
I need additional space for additional people. Also with that is, theoretically, looking at math-wise with my background, the first 5 years, you're gonna have the uptick where you're gonna have a bunch of non-compliances, people are gonna say, I'm not gonna pay it. The next 5 years, theoretically, people would say, I'm not doing that again because I lost.
Right.
And then you'd have a downtick, which means I need less staff.
Yeah,
So these positions may not be super stable long-term.
yeah.
But I also can't risk being behind, whereas if I understaff it, we're behind by 2 years, we're probably never gonna crawl that hole. So theoretically, at least for the first the year 6 through 10, we would need an additional 6 people, which would be about 3 to 4 years from now. But I'd have to hire 1 to 2 now to get the ones we have in place now looked at.
So the problem then is the anticipated increased workload, staffing requirements, and along with that, workspace requirements.
Right now, best case scenario, I've got 1.5 offices that probably are unused, and maybe 1 cubicle. And that's if we like move people around, we doubled up.
Right.
I have to face like 1.5 people probably. That's not gonna suffice.
So
It's
what, so
primarily guaranteed already just with the growth of the program.
is the prosecutor's office saying like they won't touch these, or is it a wait and see kind of attitude?
So no, they have said, when I talked to Mr. Flays and his team, they don't have staff in the prosecutor's office for it. And then they do believe that the courts, they had a hard time keeping up with for sale property, and that was 20 to 25 a month.
Yeah,
We're looking at
all
100
places.
or more. So it's gonna be a bottleneck at both points. So that's where I'm worried about, is when we start heading to that territory. And this was not planned, because originally, as we mentioned,
Right.
my entire plan for O&M and Mr. Lark's was that the prosecutor's office would take these, they would run with them, and they'd give them to the court would handle it. And that way we weren't in people's yards, because I don't wanna be there more than we have to be.
No, it's true.
We didn't have to deal with them ourselves in terms of like, you listen to the prosecutor a lot more than you listen to the sanitarian. When the prosecutor says jump, you generally jump. Sanitarian may be like, sure, give me a legal letter and then I'll jump. So, there is another option that we are going to look at if the board be so inclined. We could ask for maybe him to assign it outside the house and see if somebody else can handle it for cheaper. Because again, my assumption is if we have these non-compliance teams, it's probably the most expensive option. Because you're figuring $50,000 to $75,000 a person with benefits.
Yeah, in tandem for safety,
Right.
plus possibly police escort or sheriff escort.
More, at least on occasion, the sheriff would have to be involved, yes. Because there are gonna be some people that are gonna say, get off my property, I'll shoot you if you come on there. That does happen. We would have to, in rare cases, the sheriff has to be involved, and I gotta pay for that as well, more than likely. So between those different outlets, it's not ideal.
And are there any known, like with this, the time spent with Lake, are there any known options to?
That question was posed to us in Lake, the prosecutor's office handles it. So we don't do this. It's different though. The prosecutor's office in Lake handles it. We aren't doing the
Yeah, I feel they have enough infrastructure, if they can address it.
How many non-compliance do you get?
Who's starting with this year?
We're just starting our non-compliance now. If it holds true, we'll probably we're about half your guys' size, except so much, probably 50. But again, it's just it may just be a different look at it, how it's being handled. There is a thought that possibly someone like Mr. Kashira's firm or someone similar could do the heavy lifting for us.
Yeah.
Ballpark, I'd probably look at $12,000 to $15,000 a month, at least those height years. It's still half of what we probably charge to do it ourselves.
Yeah.
Still significantly less.
And changes the fee structure significantly.
But I need
Yeah, that's true.
I need to have 2 discussions with all of you, is where do you want us to look at one route over the other? And 2, if I go to Mr. Flays and ask for him to look at outside, can someone else do it? I need your guys' opinion to do that too. I can't do that.
Yeah, I think we should contract it out.
Okay,
That makes the most sense.
so maybe at the end of the meeting, we'll do a motion to do that. We also need a motion, which we have to wait for all the, we need a motion to send the lease agreement that, Jerry and Linda sent to us, Jerry and Linda, to have a special prosecutor assigned to review that as well. Because, that has to go through Jim, and then Jim has to go to the court has to sign somebody else, and they review it.
So why can't Jim do it?
He says a conflict of interest between, he represents the county and us.
But he's not representing the county on this, right?
He's not really either one of us, we
So
both,
there's no conflict of interest then? Okay.
we both have,
Well, there is still, he still has a comment, and what he said in his letter to us was because he was involved in early meetings where,
wait,
Mr. Quaid,
yeah,
that
Yeah.
when the initial discussions occurred, he would be, if this came
be
to
a witness.
a big issue, he would be a witness, so that's where his conflict arises.
But we're just hashing out the terms.
That, we both got the same, more or less the
Okay.
same language that said
Yeah.
he's not gonna
Alright.
do it. So, at the end of the meeting, I'll have to ask for that as well. Jerry and Linda are still here if you guys would like to ask them questions, because you have received the lease, you at least know the general version of it. But also if they have questions for you. The thing with the recent change in what we need square footage possibly was literally occurred like yesterday. This was not something I've had sitting on for like a week.
Right.
I think it was actually Monday, sorry, I think we met Monday. Dan and I have been going like over everything since Monday as to what it would look like, how many staff, where we put them. Because even if we do this, that room that we're looking at for ADP is not ideal to put 6 people in, or 4 people in, because the bathroom is gonna be an odd situation, like walking by them all to go to the bathroom. Smells, sounds, things like that, not ideal probably. And it's also not,
Quotes here on that.
right, that'll be the Maple Leaf tomorrow.
Yeah.
And then you've also got the
That's the
issue,
headline. Smells, sounds. says
you've also
that.
got the issue, it's not set up for desks now, so we have to buy desks, we have to buy partitions at some
Wires.
level. Those are all things we have to do.
You're not wrong about that.
Yeah, wiring becomes just topic, they can drop in lines.
So those are some of those things, we don't know. Also, real quick, there's no sound on the live stream, I was just told.
Yeah,
You're working on it?
Yeah.
we're working on
Sorry,
it
okay.
right now.
Oh,
So-
it's not gonna be in the Maple Leaf.
I'll say it again with the sounds on
Okay,
it,
all right.
sure.
Alright, thank you.
Just randomly, I'll yell it out.
It probably started up just then.
So, again, if you guys wanna ask questions, or if they wanna ask questions, you, but this is a relatively like this week new item that we're not trying to adjust the entire
Right.
program based
Yeah.
on, that is gonna be,
And is that fellow that you showed, that example you showed us, of the guy, what was it, Schultz?
yeah.
Is that a good example of what the reality is?
Those things happen, yes. I mean, that, I'm not sure it would be to that extent or maybe even more than that, but that's an example where we work with people for
That's
6 to 8
not
months at a
simple.
time.
That's not a simple thing to solve.
It is not.
Practically, legally, or anyway.
Well, and so my thing is, whatever we set the current non-compliance at is where we're at 6 years from now when we have the whole county online. So this needs to be well thought out and well done versus fly by the seat of our pants, and we've got 40,000 systems, we're like, well, it kinda worked, it kinda didn't.
Yeah.
So, I guess, what are your guys' thoughts on the lease? I'll need, either way, I need the permission to send it to Jim to get a special prosecutor signed to come back and talk about it.
Okay, well, let's do that.
Okay, so if, it'd be just a walk-in item, so it would be permission to,
More discussion.
yeah, permission to request, the prosecutor's office to sign a special prosecutor to review the lease for Geauga Public Health.
You need a motion?
I need a first and a second.
So moved.
Second.
All those in favor?
Aye.
All those opposed? Any abstentions? All right, motion carried. Now, any discussions for Linda and Jerry? You have-
Yeah, so the main thing, oh, I'm sorry,
No,
Eric, did you
I was
go?
just gonna say, with this new information, I haven't had a chance to talk to the commissioners
Yeah,
about it, but my assumption would be if you needed that space, then we would not be going through it in any of the major we would not be going through taking the space back if you guys decided you're just gonna go with the staff.
okay.
I don't think that would be an issue.
Yeah, I appreciate that, I mean,
So, but I was at least was still something we wanted to get put in place, and just be, if you need an additional staff, it'd be additional square footage, so.
Okay, so the biggest issue I saw was this termination for convenience language, where it says, essentially the commissioners can terminate the lease for any reason after giving 60 days notice, and I don't know what you need as far as notice, Adam, to find a new space.
I
and
mean-
pick everything up and leave, but I think it's significantly more than 60 days.
Yeah, I would assume, sorry, I'm answering all, I mean, tons of text messages about.
No, I
this
just got one too, about the no
audio.
audio.
Yeah.
My assumption would
hanging
be,
around.
I mean, I'm not sure, I mean, you guys can put it at your side, I mean, it would probably take us 6 months to relocate.
I would think at least,
Yeah,
right?
I mean, and I think that'd be assuming that the market's not
I mean,
terrible.
frankly, I think there shouldn't be any termination for convenience language. If there is a default in by Geauga Public Health, then I think there could be a reason to terminate early, but just terminating for convenience, I just think that should be removed probably entirely.
What section is that?
Well, I changed the numbering, so I'm not sure,
I
but I
have
think it's
23 termination. Is that standard language in lease agreements for this type? That
I
would
mean,
kind of-
I've run in an apartment before.
Yeah, I was gonna say, I've never seen it just
Yeah,
out of
they
like,
can just
what
kick
you're
you
saying,
out.
convenience, it's usually a little more,
Right, well, and the other thing I think about is the way it's written, like, the commissioners could say, hey, we're kicking you out in 6 months, end the lease, and then, you know, if we're scrambling, like, hey, we pay more, then they could renegotiate, I mean, we don't wanna be in
There's
that
also
kind of
concerns
situation.
with your Medicaid provider number and relocating
Yeah,
it for
you're-
payment, and also federal statistics being that it's basically like
yeah.
brings, you know, security truck paper and everything.
Yeah,
I'd say at least 180 days, but it is very one.
But I mean, I don't think we should have any, like, termination for
No.
convenience language, we're negotiating this now, if there's default, that's one thing, but that's just my opinion.
Yeah, I would change it to just standard language that's found in like a lease agreement for this type of space and lesser lessee.
And we'll have to provide any changes you guys want to whoever he assigns. I don't know who, if there's a pool
So
of
we
people.
just get like a random person?
I don't know. We've only done this one time, and that was when Mr. Kashir was assigned to us, I believe. And that was a long time. It was
Okay, because
like-
we've just been hiring him for different matters. Is that-
correct.
but
He's not,
that's-
we have a retainer, so we can use him for stuff that is more like in-house items.
Okay, but this is not an in-house item.
From what I was told, no, this has to go through that process.
Alright.
It was a learning curve for me on that one.
Yeah, well, me too, that's why I'm asking. Other thing I wanna see, I mean, I redlined this, but I'll just talk about the nature. I'm sure my fellow board members will not be surprised, I have a lot of red lines.
You do.
Oh, lawyers,
Yeah, yeah.
Shocker.
I didn't spend that much time on it, but there's still a lot of red. Is we're gonna want some sort of description of the backup generator power, included for, you know, to carry out the critical functions of the organization. What else do we got here? Oh, this is prior section 8. There was a numbering issue, I think there was one
What
numbering
section are you
issue.
looking for?
So the alterations,
It is 8.
yeah, I think
Which is a,
that's 8.
Yeah.
So at the end, it says unless otherwise stated herein, it is within the lessor's sole discretion to determine the location, dimensions, and character of all improvements. So I think we need to, that seems pretty restrictive on us. We gotta get rid of that indemnification, which is 12. My understanding is political entities can't agree to indemnification language.
Yeah, I've confirmed that as well.
Okay, that was my understanding. Okay, how about this access by lessee, that's, section 15 regarding, it says, last sentence, that lessee agrees to generally maintain the same work hours and days as are kept by the employees of Geauga County. I mean, I know Geauga Public Health can have emergency-related issues that it needs to be here
Yeah.
for and so forth.
Yeah.
Yeah, operations,
Trainings,
exactly.
yeah.
In general, at least once or twice a week, Mr. Lark are either super late or super early.
Yeah.
So,
So I think that's something else, and I think those are my big. Oh, and then just the default by lessee, I mean, we need to make that bilateral, I think, because it's just unilateral language right now, that the commissioners can end the lease for our default, but we can't end it for their default. Okay, and then the last big thing, the holdover provision, which is 18, I think we're gonna have to clarify what a holdover rate would be. And those are the major, I mean, there's more, but, you know. Those are the big ones.
That's the new.
I'm not gonna go over it all stuff.
would it be helpful to send an email with those?
Well, I think we
Well, we
probably
got-
need to send it to the lawyer first, because otherwise
Yeah.
Right.
so we,
Okay.
even though she is a lawyer, we're not allowed to
No,
act
I
as
know,
lawyers.
I'm
and
not,
She's
send
not our-
I'm not your
changes.
lawyer.
So the other thing that will come up is if we decide to do the non-compliance in-house, we would have to discuss with Terry and Linda about, you know, where they have the furniture, purchasing more furniture. modifications to the space, things like that, if we have 6 more staff.
Okay, so maybe that's something that needs to go on the lease as well, as I know that talks about like improvements.
Yeah.
Expansion.
Yeah, but how,
'Cause again, I don't know what the level, because if you're talking about the level, you know, when it says like we can't change the space, it'll be like, what level of change? in
yeah,
space?
that's that alteration signs and fixtures.
I don't wanna take tables out and put tables in, have you guys be like, hey, you gotta, you know, or if we're contacting ADP for drops, I don't know what your guys' process you want for that is.
Yeah.
If we go that way, which I think is the worst case scenario, if we go that way. But, you know, I don't want to go that way, but if we have to.
Since we've identified potential concerns, problems, would it be worthwhile to have a meeting later with some group of us and
I think really the first thing is the prosecutor,
Yeah, we just need to.
is that person has to review it first, because we can't really do anything until that person
Right.
signs.
No, I mean, I just flagged these things because we've got Jerry and Linda here now.
Yes, yeah.
But,
And those were, I think, the majority of concerns that either were voiced at other times or someone, you know, reached out. It was, those were the main items.
yeah,
Thank you for the efforts
I didn't
put
hear
together
anything that
those.
was out of bounds.
yeah,
Something.
I figured, yeah.
I think it would be better to get to an agreed upon version before we start pulling other people in.
I think we put, so we take what you said, if anybody else has any other comments,
Yeah.
we can make those adjustments before we start spending money on an attorney.
That's fine, I mean, I can
Let's
send,
make sure we have something where we both sides agree with.
yeah,
If
I
you wanna
can
send
send
me
you
hers,
my,
I can send it
Outline.
to the full board, obviously blind copy, so there's not a concern with anything. And I did, just for heads up, I did tell Jerry and Linda, Tuesday at the EMA, we had our drill about the issue with the staffing that may come up. Because I didn't want them to come in here blindsided by,
Right.
you know, we were getting the space.
Slow down before us.
I told her, yeah, I mean, I said, we were stuck together for 5 hours at the EMA preparing nuclear drills, so.
There was a lot of free time.
Just waiting to see what happens, as always.
Gosh.
So anyways, that's where we're at with that. I mean, it's just, there were a lot of curveballs
Yeah,
very quickly this week. Between the lawyer, the outsourcing of that, just for lack of better words, also using, the space possibly, there was a lot of changes. And so I want to at least give them a heads up so they're not coming here and blindsided by 15 different changes that they weren't ready for. But I also in my head talked to you guys as to what you wanted to do as a board, because obviously I don't have the authority to just hire 6 people. Now granted, it'll be over like 5 years, but we have to ramp that up with at least 2 people probably, you know, the next couple months. And it's a lot. I mean, we only have 20 staff, adding 2 people is actually a pretty good, you know, amount. So,
So could there be a price comparison between contracting it out and what that would look like?
yes, that's what I'm hoping. Once I send this over to Mr. Flays, if he's willing to allow that, and he says, my assumption of why he's gonna be involved is because it has to be somebody acting for the county. So I'd imagine he's not gonna let a private firm act in the county's capacity to some degree. If he says yes to it, it's gotta be cheaper, I imagine. It's more of just sending letters saying do this.
we could say no,
I don't know.
even though we paid for
I don't know. He's saying he doesn't have the staff. If it's an outside firm, they probably do. And my assumption is from looking at rates, it's probably 12 to 15,000 a month.
You do that on new business as well?
It's not a new business because we have to go to ask him if we can even do it, yeah. It'd be a conversation with him, but again, as I'm aware, he is, like, I don't have the authority to just randomly, like, hey, the board wants to do this. What if they say yes to it? They didn't.
it. Okay.
So I want to make sure you guys are okay with it first before I go asking for large contracts, more or less, or even bids for this. It'll probably be bid out to some degree unless it's a proprietary type of a thing. And
So can I clarify what I think I heard? There's still a possibility that the ADP people could move in there if you outsource this?
I would imagine, yes. I mean, my goal would be to outsource. It's not because we don't want to do it, but because of, I don't want to be building backyards. I think it adds
Yeah, and financially, I
conflict,
think it makes
it
sense.
adds issues,
Yeah.
and then, again, my main concern is I don't want to be known as the employer that I hire people and then lay them off. And if it spikes again, I hire people and I lay them off. I don't want to be that guy. I mean, I also don't want behind to know how you guys are going to feel like if O&M is behind by a year or two. That can happen.
And given the budgetary constraints and everything we came through too, we wanna make sure we're good stewards of dollars.
Yeah.
So
Yeah.
we're gonna try to do the.
Correct.
I mean, this
Most
program
effective
just shouldn't have to
as
exist.
possible.
Oh, no.
The outsourcing, not outsourcing.
Your lips to
benefits.
God's
Yeah.
It's just, it really shouldn't.
Yeah.
Well, I mean, the law could change. so
The old
it's not-
legislature says differently.
Yeah. I mean, I renew my suggestion that we send our state reps and state senator a letter letting them know, like, the strain that this puts on health departments.
I have reached out to mostly Steve Demetrio and to Sarah Fowler Arthur, just because she goes to my in-laws church, so I see her off and on. they're aware of it, it's the tough part is it was voted in, if you voted out, is my understanding.
Yeah,
Unless
they have
you
to
did
change
votes
the
to
law.
vote out, yeah. Not saying they can't try, but I think it's not a simple like,
Well, maybe we need to draft a letter signed by the board, that way it's.
Yeah, that's
more
my
weight behind it.
suggestion, yeah, more formality
Yeah, I
to
gotta
it.
draft a bill.
And we could send it to Senator O'Brien as well.
yeah. We have Dave Joyce as well that we can reach out to, just, bigger stick in the nails.
Yeah.
It's state law though.
Yeah, he just has a bigger stick with some of the stuff that
Yeah.
he knows,
That's true,
So.
that's true, yeah, because it's his county, so.
Mhm.
Yeah.
he has some say in there.
So you can't really finalize the lease until you know what the square footage will be.
Right.
Correct, and also I can't finalize without Jim's lawyer reviewing it, and I can't, ADP, or not ADP, the auditor's office won't let me sign it, let them sign anything or myself until the lawyer check off has occurred. I think it's the same process for you guys, I'm assuming.
Does the prosecutor still review it to form, or how's that work?
I do not believe so.
Okay, but I mean, we can still negotiate these terms we're talking about, I think.
I don't see why, not.
I mean,
it's
it's
just,
a
it's just
square
discussion, I
footage.
think it's fine.
Yeah.
If it was like us saying legally we're changing something, we can't do that, my understanding.
Theoretically, we could take out the reference to specific square foot and just have the square foot price that evolves over the
Yeah,
years.
yeah.
And we could do it
Yeah,
that
put
way,
it in
if
a
you're comfortable with
attachment.
that.
That's good. I
And
don't see
then
why
we could
not.
just determine what the final square footage is and it
We
would just
actually-
be applied.
That's how we actually do it in Lake for our contracts, and I just put a price, and they just
And you
pay
just
the
do
price.
that.
Yeah, so they expand, it's easier for us to do it when we contract.
Yeah, because they don't change the contract if we do expand, we just change that.
Yeah. It's a bad idea.
And
Any-
the other potential problem with independent contractors is what if they decide to work for their own interests rather than citizens or Jarvis County?
I think it's all done, I think what you're talking about.
Right.
The attorneys?
I mean, they're obligated to us, which
Yeah, but
you are.
so
obligated
it's
to.
never-
Compliant,
It's
they-
never
they-
happened
they
that
have
an
to do what
independent
you want.
contractor hasn't done what's in their best interest rather than the county's?
No, you give them fiduciary duty
Yeah,
to your
I-
client.
Yeah, I mean, I think they'd be like legally on the hook if they've got to accomplish
Where's
the
the
task.
ethics?
And that's never happened.
I mean, there's a lot of things that happen.
Right.
I just the
I mean,
probability
we
of
have a
happening
new-
is the question.
A new unknown problem now with the potential workload in space. You know, what's the next new unknown gonna do?
That I do not know. So, any additional questions from either side that we can help you guys or help with, or?
No, I think
No.
this is all helpful
Alright,
discussion.
I'll get Carolyn's copy from her and send over to you guys just so you have it, and then I'll send it to the rest of the board. We can't
And
collaborate,
just-
obviously, but you can at least see what's provided.
Yeah, just the removal of the square footage.
Yeah, it's just a
Yeah,
draft,
that's a
so,
good idea.
all right, thank you. We'll see what
I feel like
happens
we're
next.
starting to be friends here.
No, that's great.
Come on, way.
Here we are.
Next time, same bat channel, same bat time.
Thank you both again for your,
Every step gets us a little closer.
That's what we keep telling ourselves.
Well, you have to, or oh my gosh.
Yes,
It's always one that's announced, so.
yes.
Throws the wrinkle in it.
You never know, you never know.
All righty.
All right,
Yeah,
thank you.
good night.
Thank
Good night,
you.
guys.
Have a good
So we're
meeting.
going back
Thanks.
to the report.
Yeah, now back to population health.
So now we will return to the population. Now let's do some staff report, starting with the population health report.
No update unless anyone has any questions.
How many raccoons did you hand out?
All of them at the fair.
How many?
I think I ordered 1,500, and they were all, we actually, we sectioned them off by day, 'cause we knew they would be crazy.
Mm.
And we had people, they told me throughout the entire thing up until the very last minute, saying, hey, I just heard, and we're like, we're literally out, like, we don't have any left.
So more next year.
In a plot twist, rather than a raccoon biting person, my son bit the ears off of the squishy raccoon. I was like, well, this is ironic.
First time they transferred rabies the other direction.
Right, I know, I was like, you can't have this anymore, but yeah, I chopped it a
hands
little
foot mouth
bit.
disease.
Into the raccoon.
We're already gearing up for what our animal will be next year, we're sticking with the farm theme, so we're looking at a horse or a goat or a chicken or something like that, so. I want to do a chicken so we can give it away as like the prize at the school, we get some fun flying chicken.
You could do
Yeah.
it bad
That'd be
for
fun.
rabies, though.
Yeah,
Collect them all.
you know it.
Okay.
Any additional questions about population health?
Nope.
Environmental health?
No additional updates other than, like I said, we'll talk about that, well, I can talk about it now, just in case he does come in. We have that property, I passed that sheet around that gave the timeline.
Yeah.
That gentleman, he was given a letter, actually, you know what, I'll pass the letter around to you so you guys see what goes out. That hurts to see what they get. So this letter was sent to him on August 13th, I just need these back, these are the file copies. But he didn't show up to the last meeting, so he was told this is his mediation night, his administrative hearing, I should say. He's not here either. So he did get this letter. if he shows up tonight, we'd have to administrate a hearing, hear what he has to say, he may say whatever his reasons are. Yeah, we tape it to his front door even too. We do everything, we tape it to the front door, we'll do certified mail, we do regular mail. We go out to the house, try to make sure we contact him. If he doesn't show up tonight, at the end of the meeting, we'll add on to the business, send him to the prosecutor's office. And then he'll have to go with the prosecutors, what they're gonna do, and they'll refer him over to the courts at some point, that he has to do this. So that just gives you an idea of what that letter looks like. The timeline I thought was important, so you guys see, like, this is not like August 1st, he didn't comply, this is
No,
like
it's
March
been
3rd or something like that.
Ongoing
Yeah.
issue.
And we haven't gotten much of anywhere with them. So, and obviously we don't want raw sewage being put into a ditch somewhere, because that's not
Yeah.
healthy for anybody.
No,
Other than that, the only thing that we have really for EH is I passed the food fees out. The third and final reading tonight, we're actually gonna reduce the fees. We were able to save some money on some of the program stuff, and those fees are only meant to cover the cost. So we will reduce those fees, about $5 per fee is what it'll be reduced by, roughly, from what we originally proposed. So I imagine that no one would be sad if we reduced fees to the public.
nope.
Other than that, there's, Mr. Lark, I said he's tonight at the, Perry Nuclear Power Plant drill for Geaugus portion. That just coincided tonight. Yesterday, we had the EMA portion at it, where we were at the, Emergency Management Agency, DES, they also call it, and we sat there with Jerry and Linda for 4+ hours. I think you were probably at the lake one. Yeah. So, we all survived, there's no zombie nuclear apocalypse, this time.
Yeah, the feedback so far has been good.
It was, I agree, it was good. The wind always blows southeast, so you're only screwed if you're southeast. But other than that, that's the update for environmental health, unless there's any questions.
Yeah, someone asked me the other day about how to find out about violations at restaurants.
Yeah, so that's actually a good question. So the question I usually get comes from people who get angry that in Lake County,
Well, that was the.
it is,
You can find it online.
Yeah.
Like postings.
it is
too.
readily available online. You can look at many restaurants, see their criticals, their
Right.
non-criticals. So that's because Lake County uses a program called Health Space. You would put everything electronically. Geauga never got on that. We are actually meeting with them, I think it's this week or next week, to look at activating that program here. It does come with a cost. It's still the way of the future because you're doing it online and it's all electronically submitted. There's
Is
no,
that
like,
what all other counties are doing?
a lot of them, yeah.
Okay.
This is just something, and Ron, and Lake's been on this for a long time. Those reports have been out there for 10+ years, I wanna say.
Yeah, at least 10 years.
Okay.
Yeah, so we are moving Geauga in that direction. The other part that came with this was Excella, which was the program we were expecting to be using. They keep shelving it, like, and pushing it back, and now it's
just ODH.
like, yeah, it's like 2 or 3 years behind. So Health Space is the option, is currently available, currently out there. It's working with them and started that process, see what the cost would be at implementation. And with the new tablets that we got everybody, is that they have a computer that folds into a tablet, they can do this all in the field.
Yeah.
Okay.
So it's not gonna be like right up, they come back here and be just, checking it with your little pen on your tablet.
And there's no sense from Lake what the cost roughly is.
I'm sure I could pull it out of that, but off the top of my head, I don't know. So we just started this literally like yesterday. I had Dan and his team reach out to Health Space and ask for a demo for the team that's here, and also to get the process rolling to start the program.
Yeah, I wonder if there was a way to like share a license with Lake or anything like that.
That would be part of the discussion. Is technically,
Yeah.
it's all Lake County employees for the most part. So
Right.
is it just as simple as like Geauga pays a portion of the fee,
Right.
and that's what it would be. We don't know yet though, because I don't really know how their contract is written in terms of like location area things.
Yeah, data ownership. and
Yeah.
things like that.
So I've got to double check that.
And
But-
there aren't any known county
No,
sharing.
we're the first ones really, in terms of this aspect. But once we get that up and running, yes, those reports will be online, and you can just go online and look and see, is your favorite restaurant having issues, or,
Sometimes ignorance is bliss,
I
though.
know.
Yeah.
you ain't wrong on that one.
Don't
Yeah.
wanna know.
Some people do though, so that would be a good service to the public, so.
Any additional questions on that one?
And next is the administrator
Yeah.
report.
Just the main update is obviously Mr. Lark and I were at the meeting with EMA. That went super well. Tonight is our graded test for the KI, potassium iodide distribution. Generally, I will say we have a ton of experience between Mr. Lark, myself, and some others, and so we already gave some insight. Because for those that don't know, if the nuclear power plant something happened, there's sites you would go to for KI and other things. They did it last year, we corrected them, and I thought they corrected this year. If you're a person coming in that's deemed clean, so you don't have any contamination, you're supposed to go into one area and the contaminate goes somewhere else. This is the second year in a row they've had them crossing each other. And I corrected them last year and said, you don't want to deal with people like, it's not like the traffic game, like red light, all right, you go. And so they pulled up the description again, and Dan and I just kind of shook our heads, and they go, what? And I said, you freaking got him crossing again. So they're supposed to correct that. We don't know if there's enough time before the drill tonight, but they're supposed to correct that.
Yeah.
For the fact that it was as simple as you just have two lines, and then the one wraps around this one and they're clean.
Double the potassium iodide.
Um,
immediately.
The potassium iodide, doesn't it have a 40-year, if you're over 40, you don't get it?
You can get it, it just doesn't really do much if you're over 40.
Yeah, there's dosages by weight, there's dosages by,
Yeah, they don't recommend it.
yeah, it's recommended dose, or, yeah, so, we'll,
40.
is it 40?
40.
Yeah, they don't recommend it, I mean,
Yeah.
you can still take it.
Yeah.
And there's dosages for your for certain weights for children too.
Right.
I don't know what those are, but there's dosages for the
Okay,
kids.
it's 130 milligrams adult dose that covers a
Yes.
24-hour period.
And then you cut it
And then
down.
less for the,
Yeah.
Do they have any plan, the really horrible thing are burns, and like 3rd and 4th degree burns, so is there any plan for that?
So for, American Red Cross is there, but that's kind of outside of our scope to some degree, like that'd be more of the hospital.
But that's what I mean, there has to be kind of a group plan.
Well, so on this stuff, like the Red Cross is involved, it's a tri-county, actually, well, Cuyahoga's involved too partially, right? Or no?
we typically don't get involved in Cuyahoga County, it's, well, we look at
Because
it primarily
there've been
as
some
10 mile
lessons in
emergency
nuclear
planning.
power plants in
Is
the
that-
world that have gone
2
through
hours
this.
less.
Yeah, because it touches just Thompson and Geauga, it touches
A little bit,
Marquette,
yeah.
Deal on the lake,
Yeah, up to Geneva.
Geneva, yeah. So
You
it's,
don't need to learn again.
so for all of those involved, we have multiple agencies there, we have the fire departments there, we have police departments there. The EMA thing, which Ed was involved with yesterday, we go through that whole process of like, there's always some crazy, like a helicopter falls out of the sky, or, the biggest road in the county gets congested, I mean, there's always some,
Septic tank that fell over yesterday.
But also the DOD, this is a well-known, defined for years,
Right.
target by the DOD.
So anyways, we go over all that stuff, we do all those things, that was the big thing, so this was our graded drill is tonight, plus yesterday was the graded drill for EMA. The EMA one went really well, Ed and I heard that, the feedback was very positive, so that was good for all of us. The thing tonight should be great, we generally knocked it out of the park, and we took some of the staff, so Lakes was Monday night, we took some of the staff to that one to get experience, then have experience for tonight. So they kind of have an idea what's going on. Other than that, that was the big stuff besides the AOHC conference. Mr. Lark covered that because that was the same day that I had another conference. So we went down there as well and trying to voice our opinions. We are going to get $50,000 and $25,000 for our accreditation reimbursement. It still doesn't cover a whole lot, but we don't have a accreditation coordinator, so it should cover that cost. So we'll have that shared cost with Lake, and that'll cover that cost.
That's good.
And Mr. Graham, his health commissioner, well, but he submitted a lot of the reports too last week. So that's it for me, unless you have any questions.
And we did commissioners already?
That would be him right now.
Oh, yeah.
So.
Okay.
And nothing too much, real quick, thank you. Just year 3 of 5 on the cycle. We did the 2024 report to the accreditation body. There's 7 standards identified that were not met during the first site visit, even though you were accredited. We put information together with that, and quite honestly, all 7 we don't do. So here's a policy, here's what we plan to do, with some caveats of what's different in Geauga versus Lake County. They add some additions, I had to have a different form. We submitted the contract, the cross-jurisdictional contract. Their website didn't work into the form, so I submitted it 15 days early. They had me revise it, I got the right form, filled it out, sent it back in, and now they're seem to be happy, we'll let you know. I also provided Robert Rules of Order, just this PowerPoint, and just take a look at that by next meeting, look at some scenarios we've been through, with things that come up, just kind of from experience, reflect on it, and we can walk through any of those. The next will be kind of creating some kind of a checklist, walk-through sheet for the president and everybody to use it as they're covering the meetings. So again, if you have questions, there's quite a variance, so this is kind of the mainstream things that happen. There's always those exceptions that we can reference if we need to, and that's out there. Otherwise, I'll take any questions from the board. All right, thank you.
All right, old business, we already addressed the rent. We'll also have the third and final reading the increase or decrease of certain fees, and the only thing we're really doing that's different than what the last reading was, you all approved the first two, is those food fees are actually being decreased instead of increased. And that's just based on the calculation Dan and I did, with some cost savings that we factored in recently.
So it still counts as the third reading, even though the numbers are different?
Yes,
Yeah, as long as it's not-
because you're allowed to adjust it, because you guys may say after the second reading, or even the first reading, I don't agree with that anymore. I talked to a constituent, and they said they pay 10 times what X county pays. We want to adjust that, and we can adjust it.
Okay.
So we're able to keep going with those.
Yeah.
And the proposed, that's the new fee.
Yeah, I figured with reductions, nobody would probably be all that mad.
Yeah, as long as it's
Yeah.
You're saving money.
And some of them are pretty dramatic.
Yeah, there's some good decreases in there. We're doing a lot with just different trainings, different ways of doing things, and different allocations. We're able to save a lot of money. And then so we can do the third. I think we have to do the third reading first, and then we do the final at the end of the meeting. So I look for a first and a second for the third reading of the resolution to increase and decrease certain fees, food service program third amendment
Yeah.
to decrease those food fees.
So, I move.
All right, got a first,
Second.
all those in favor?
Aye.
All those opposed? Any abstentions? All right, that passes. Moving to new business, I'm gonna pass this down, we have the financial report. And I will say, I had Dr. Henderson sign the July and August invoice, those aren't on there right now, so those will be on there next month. So those will both go through. But any questions on the financial report?
This Donna Mark, is that for ND?
That was for the Wells and Parkman.
Oh, the Parkman.
We finalized everything out with some stuff that was outstanding.
Okay, got it.
Yep.
That's all, that was my only question.
Okay. It was mostly a light month, honestly. There
Yep.
wasn't a ton. Alright, so I would look for, a first and a second on the financial resolution.
A motion.
Alright, second,
Second.
alright. We'll do a roll call for this resolution, so, Ms. Jones,
Yes.
Mr. Booth,
Yes.
do both, right?
Duh.
Oh, gosh. It's like Melissa.
Over like 7.
I almost said
right?
Melissa, I'm like, I would feel terrible smelling like Melissa.
Yeah.
You
Ms.
can call all
Brady,
of us our first name.
gosh, I should
Yeah.
say.
You're gonna get it.
Dr. Henderson,
Yes.
I try, I do.
That's nice of you.
Yeah, please send us an email.
I figure I'm wrong with no matter how I
Or
do
it's
it.
a big change of pathways. We're just getting.
Right, I just got your other name down.
And it's
Um,
every time.
and then we have the permission to approve appropriations for increase, decrease. This is just one fund that we're just, because obviously contracts, how the contracts work, we're changing this. And it's just the injury prevention fund. It's one of the smaller funds that we have. It's a certain grant. So, can I get a first or a motion on that?
I so move.
Second?
I'll second.
All right, all those in favor?
Aye.
Aye.
All those opposed? Any abstentions? All right, motion carried. Let's see, I'll give you guys time to sign that. We then have a resolution for, a then and now for AA Affordable Septic, and that is for $15,064. This is a WPCLF, I know somebody mentioned that earlier. That's the Water Pollution Control Loan Fund, so he had one of these, and he started work 3 days before the purchase order got processed at the county auditor's office. So it's hard for me to tell them, don't start work early when you're fixing a septic system, spewing sewage into a ditch. So I can't fault, I'm mad, but I can't fault him on that one.
Need a motion?
Yep, need a motion, so a first,
So move.
second.
I'll second.
All right, we'll do roll call for resolution. Ashley?
Abstain.
Okay, I was gonna, that's why, yeah.
Yeah.
Yep, Melissa?
Yes.
Carolyn?
Yes.
And Dr. Henderson?
Yes.
Motion carried on that one, Dr. Root is not present. All right, the next one is a resolution for then and now for Geauga County Clerk of Courts for $320.90. And
And you need to do this for $320?
in Geauga County, I do.
Okay.
You need a motion?
I need a motion?
I so move.
I need a second?
Just asking. Second.
All right, that's a resolution as well, so, Ashley? This one you're okay with, this is just a clerk of courts.
I was gonna say, what is the?
Yeah, it's just clerk of course, you're okay with
Okay,
this
so
one.
I'm fine, so that is a
All
yes.
right, Melissa?
Yes.
Carolyn?
Yes.
And Mark?
Yes.
All right, motion carried, resolution carried, and Dr. Root is not present. And then the second to last one here is going to be permission to enter into a memorandum of understanding with the Ohio Environmental Protection Agency for the implementation and coordination of the House Bill 110 program. For those that don't recall, this is the one that paid $1 million back to the public. We were able to keep this with the process we put in place to not allow it to happen any longer. So we were lucky enough to keep this program here with us.
And pertinent, we got to bring it to the board so that we were clear on
Yes.
expectations and scope.
Yeah, that's what I was wondering. Yeah.
Adam, did we skip 6.02?
Oh, sorry, I had these out of order.
Sorry, because I'm like, what am I?
I apologize.
We have this.
Yeah, so this is the resolution for the Geauga Public Health to delegate authority to remove any utensils, materials, or pieces of equipment that are present in public health in an emergency.
And you need a motion.
So this is,
We got this one.
yeah, that's why. It got stuck with the other ones. I'm like, I don't know.
Yeah.
It already went down. So this one, the state of Ohio, September 1st, allows us to tag a utensil if it's honestly just disgusting, and we can tell them they have to remove it. That's what this allows us to do. So
I was like, how did this come about?
you may recall a recent inspection that I may have told you guys something about that had some disgusting
Yeah,
things
potato
being used for
cutters
food
and such.
preparation in the county. And this will allow us to tag those and say, get rid of them, like they're not using them.
Can I please make a motion?
You can make a motion.
Please do.
So yeah, first, it'd be a second,
Second,
and then this one that's a resolution as well. So Ashley,
yes.
Melissa,
Yes.
Carolyn,
Yes.
Mark,
Yes.
all right, a resolution carried.
It's just so casual with first.
It is.
I
I feel very
It's really
strange.
nice.
I feel very strange.
Take my shoes off.
We're gonna be sitting like crisscross applesauce here soon.
Just get a
I'm usually a Mr. and Mrs.
Done in a
person, so this
circle.
is very strange.
Yes.
Yes.
So the next one would be, Ashley, I'd probably say you'd want to abstain from this
Yep,
one.
I already have that.
Alright, so this is the House Bill 110. This is the semi-public sewage, so it's private businesses that have a septic system. We inspect those. This is the one that we had to give $1 million back to the public. This is mostly being carried out. There's a couple things that come up here and there. But the EPA, Ohio EPA did allow us to retain this program in-house, which is huge, that we did not lose the program.
Shocking.
Yes, so.
They really didn't want to do it.
We put a lot of procedures in place and we went over everything that we would do so it would not happen again. And I guess they did feel comfortable with leaving it here. And I'm sure we had a little more scrutiny than usual, but we're gonna maintain this here. So Geauga is able to hold that. So I'll need a first on that.
So move.
All right, a second.
I'll second.
All right, and then do roll call.
Do we
So
sign?
no, this will be, it's already signed by Ron, ready to go, but you guys can, if you want to look at it.
They're trying to sync
Ashley?
what you started
Abstain.
correct.
Melissa?
Yes.
Okay. She's not sure on that one. Carolyn?
Yes.
And Mark?
Yes.
Okay, so that one moves forward. Dr. Root is not here. And then the last one is going to be the final reading of the resolution we're actually decreasing the fees, but the Household Sewage Systems Program, we have two in here. We'll do the first one's the resolution to decrease certain fees, household treatment sewage systems, and this is the first reading. So we can do all in favor on this one. Sorry, no, you're gonna,
Yeah,
sorry.
like
We'll do it all in favor, but I'll do
I'll do
abstention at the end, yes. So I need a first,
So move.
second.
Second.
All right, all those in favor?
Aye.
Anyone opposed? Any abstentions?
abstain.
Ms. Jones abstains. Motion carried. We'll go to a second reading next month. Then we'll do the final reading for the resolution we're gonna decrease the food service program fees, and I'll need a first on that.
I so move.
Second.
Second.
All those in favor? You're fine with this one.
You're good.
Yep. Anyone opposed? Any abstentions? That one's carried, so that's the final, that one's done. And then the last one I have, which is I mentioned the walk-on, that is permission to send 14690 Elm Street in Newberry over to the prosecutor's office. For them to handle that as the timeline I sent over to all of you in that letter. Mr. Schultz or Mrs. Schultz is not here in the crowd that I'm aware of. So we would send it over to the prosecutor's office unless anyone has any questions or concerns. That's her alias.
You wanna see my driver's
That's
license?
Roman's alias. So we'll do a roll call on this. You don't need to abstain,
I'm
but,
going to abstain.
okay, I was gonna give you the option. So do I have a first to send them over to the prosecutor's office?
I so move.
A second?
Second.
All right,
Go
any,
ahead, Melissa can have it.
yeah. Give her one. Then we'll do a roll call, so Ashley,
Abstain.
Melissa,
Yes.
Carolyn,
Yes.
and Mark.
Yes.
All right,
Like I
So
said,
that
can't
one-
be
It's
consistent.
very though.
it is. So we'll send that over to the prosecutor's office.
That's a bummer.
He or she may come in next board meeting, once they get the official letter from the
Yeah.
prosecutor's office, that is a potential. But just so y'all are aware, that we'll be going over there now, and you've seen the timeline. And then can I get that timeline back to whoever has it, it's still down there?
I think I captured
Oh, it might be in the other documents then.
it, yeah,
I'll have to make sure we have it, if not, another one.
pretty sure.
And then we can
I
do,
don't trust myself. Is this it? I was like, I
That's
thought we
it.
all got that, sorry.
Sorry, I thought it was
Fully
there.
intentional.
I've got my checklist of things I get back now.
Hold
And
me
then
accountable.
we can do public comment unless the board has any other things to bring to the meeting? No? All right. Public comment, 2 minutes for anyone that'd like to speak.
There's a hand.
Go ahead, sir. I'm date night, he wants to speak, so I can't tell him no.
And want to give Commissioner Graham congratulations and kudos. His field monitoring teams were evaluated by FEMA last week and received a high praise and kudos for what they did. Field monitoring teams, they go out and look for a radioactive plume, like if there was an emergency at the Perry Nuclear Power Plant. That's primarily why they exist. And he has only teams at the local level in the state of Ohio, and there's very few across the nation that exist at the local level. It's mostly at the state level that they exist. And very proud of those folks. I had a couple of the evaluators pull me aside and say, we're impressed with the frequency that they train, and thank you for letting them, or supporting that they train every couple months. Evaluator told me there's some that we go out to nationwide that apparently haven't had training, and some of them never even came close to the knowledge level that your folks have, so.
Thank you, I appreciate it. We do have to thank the EMA and Bert Beckenbauer. We don't have audio, but Bert Beckenbauer, the supervisor for years, has led that team. And to thank the union staff and the staff that train, diligently, above and beyond for that program, so it's a great.
And probably should tell them this is a voluntary program, they're
Yeah.
not forced into doing this. And 3 of them are certified by the program that Bert and I put together, so.
Yeah. Thank you so much.
Well, don't thank me, thanks FEMA. Hopefully they'll say something on Friday, I don't know if you're gonna do that meeting.
Yeah, I'll make it up there,
Yeah.
Thank
So very, very proud of those folks.
With 17 seconds to spare.
you. Oh.
He was practicing it in the mirror at home, he's like, all right.
I thought, no.
Yeah.
She's probably the
Would the lovely lady in the middle like to say?
I just wanted to make a recommendation, a comment or whatever. You were talking about doing that letter about the constraints of that program and sending an official letter. I suggest you reach out to your other counties, because if we're finding problems with this, they're gonna have the same problems, I'm sure. So maybe you can get more people, and even maybe send your letter to show them what you did.
Yeah.
And the more people you get to send into your legislatures, maybe they'll actually think about it.
And we have reached out, I won't say to everybody, that'd be like a misnomer, but we have reached out to other ones. There's a couple of counties that have been doing this forever. Rare, like very rare.
Small.
But the majority that I'm aware of are unable to handle, like they don't know how to handle the program. Because it's so large, it will dwarf every other program we have by far. I mean, most of our staff will be O&M staff.
Yeah, and that has power in and of itself. There's 88 counties and only 8 of them are really in the motion, so I mean, that speaks for itself, so. we'll take that
So,
under
I mean,
consideration.
it couldn't hurt.
Yeah, nothing can hurt at this point.
Yeah.
I would say especially the counties who have a volume similar or close at
Right.
least to what we do, because I would be curious, and I was just kind of over here mumbling to think if there are any counties that are succeeding with it, do they actually
Right.
have a high volume of systems like we do?
Yeah, and from what I'm aware of, with talking to Dan in other counties, no. I mean, it's probably lower level ones. I mean, even in Lake, it's tough, and Lake only has 15,000 systems. We're at 30 to 40,000 here that we think or know of, give or take. The bigger concern that I think all of us have, that I have personally, is that there are some areas that the septics are failing. And they're 50, 60 years old, it's highly unlikely they'll pass. With a sewer tie-ins costing today, we were just talking about this, it probably is gonna cost $50,000. Those houses and lots are valued at probably $50,000. You can't tell someone whose house and valuation is $50,000 to tie into a $50,000, you know, between the excavation, the collapsing,
Yeah.
all those things. Now, it could be 30,000, but the rough estimate is like, it could be as high as
You
50,000.
have to take out like a home equity loan and if your house is only
Yeah,
worth.
and there is a rule in the law, and Ron probably knows better than I do, but something along the lines that you can't create a hardship, but at the same time, you can't pollute. So the two are like conflicting of like, you can't have a hardship, but you also can't pollute the environment.
Yeah.
Yeah, and it's tougher, the regulations for environmental health septics were from 1975, so it took them 10 years of fighting from 2005 to 2015 to get where they're at now. Now we're in the same point where it's gonna be
And there's
a
not,
nightmare trying to get anything to change,
And
but.
we
there's
do
not a
have,
whole lot of relief options other than
No.
WPCLF and
That's
us working.
and we only get 50 to 75,000 a year, which, I
Right.
mean, that one system was
One.
15,000, you
Yeah.
blow through that money. The other tough part we have is, you also have, not in this specific example maybe, but we have went places more like House Bill 110, like a business we just had where it's a mobile home park that is leaking sewage into a nearby stream. We told them about it, and we've gone, we actually called the Ohio EPA in because they wouldn't listen to us. And their owner on the phone said, we're not doing anything about it, you can close them down.
Is that in Warren?
No.
Is
It's here.
this the one I
It's
go
in this
to?
county, it's in this county. And I mean, none of us expected the answer from the owner, like, shut them down. Yeah, I'm not dealing with it. And it was like, okay, like, if that's what you want, then that's,
Yeah.
you know. So, yeah, I mean, we'll definitely voice it. We voice it usually at AOHC's meeting, the annual meeting, we voice it other things, because it's, I mean, there's one county that is on their 4th iteration of O&M. It's failed, the program's failed 3 times, they've restarted it on the 4th time now.
Yeah.
And they're asking us, can we do it 4th time? In essence, we're like, I don't have the staff or the manpower to create another one somewhere else. I give you a template, but I can't like have staff run that for you.
Yeah, the involvement we have in Lake County with the prosecutors is kind of unheard of, so we're not, I'm not sure how, like, I it's replicable outside of, you know, a few counties as well, so it's very challenging.
Good discussion you
Yes,
stirred up there. Good
Yeah,
job.
because I was wondering what other counties are doing as far as the enforcement element with O&M. I mean, I understand what Lake is doing.
A lot of them, and I shouldn't say a lot, some are slow rolling it, some are trying to figure it out.
Yeah.
I think a lot, I'm not saying a lot, but I think there's a degree of people who are probably like-minded with myself, where we're sitting there going, what are you gonna do when you finally hit those pockets of people that
Right.
this is gonna throw them out of their house?
Yeah.
Like, that's what's gonna happen.
Yeah.
Yeah.
And no one wants to do that, at the same time, you can't have raw sewage going in a ditch, but it's that thing of like,
You have to have a functioning
yeah,
septic.
who's gonna do that? Like, I mean, you got somebody to walk out there and like say, hey, you're done.
And rather than taking those late fees and turning it back into the community to help, we're gonna have like outside counsel handle it,
Yeah.
and that's just sad.
The original thing we wanted to do, and we were told that it's not in the codes, we can't do it by ODH, was, the thought process was if we had a non-compliance or late fee, anything that was garnered in excess of the true cost of the program, we would then turn into like our own version of a WPCLF,
Yeah, like.
Yeah.
and then help people get their systems in compliance.
Yeah.
Right.
However, unless they changes, we were told that that's not in the codes, you really can't do it.
Yeah, that may be your crack in the armor or something like
Yeah.
that, it's hard to argue on the front page of the newspaper, you know,
Right.
how are you gonna answer that if you're the
Which-
state, so, you know,
Yeah.
that's the leverage point.
That's where I think Ron is the black sheep, Devin Health Commission, but our thought was, who's gonna fight me on that? Like, do you wanna go toe to toe because we help the public? Like, go ahead, I mean, like,
Right.
try it.
Do they have any idea how many people will be a hardship?
It's gonna, I don't know if there's a number, but it's gonna be, I mean,
Like over 50%?
I don't,
Think of the age of
I don't
the
think,
systems
it may not be
out there.
50%, but what worries me is 2 things, is you're gonna have like the certain areas where the houses are probably on 1/10 of an acre and they're $50,000 houses. Then you're gonna have the people who are gonna say, I'm gonna fix income, I get $2,000 a month from Social Security, and you want me to put a $15,000 to $20,000 to $30,000 system in the ground with everything said and done, landscaping, everything. That, I'm not sure that's feasible. Like, I mean, if you're 65 or 70, are you really gonna take the money out to do that when you're probably like, you know, I'm just trying to like survive?
Yeah, you're gonna say,
Yeah.
We're not, and I can't promise it, but I think one of the things will be after that, kind of the statement letters, looking at our GIS programs, looking at septic systems, plotting them down with the economic data, the property values, looking at health indicators,
Yeah.
you know, illnesses, and maybe there's some patterns we can look at to leverage our point. But that's, again, that's a very good program for us in UH, but, you know, 6 months or so, I think we should have that, some of that put together.
That'd be really cool.
The two states I know that are absolute disaster, Louisiana and Mississippi. And from what I understand, I haven't looked at this in the past few months, but it's an absolute
Oh, I'm sure,
It's-
yeah.
I mean, beyond disastrous and no solution.
It's, I mean, obviously, if you're a county that has 1,000 systems, 2,000 systems, it's probably like, that's something you could easily handle. When you have 30 or 40,000, and we have some very old systems in the county,
Yeah.
that's a whole different
Tough soils
state. I mean, if you're talking, what, populations 95-ish thousand, you're talking, you know, if you cut it in half, more or less, it's half the people are living in a home that's septic, it's rather old. So, you know, just making it simple math. But would the other young lady on the right like to say anything?
I have nothing to say.
Oh, no.
All right.
So this is
well,
like, this is like reverse.
Huh?
She's like, Uno reverse, gotcha.
Thank you.
Anything else from the board before we would adjourn?
No executive?
Not unless y'all wanna have one.
No,
No.
I don't.
I